You step up 2 small stairs to grab the mail and, out of nowhere, your breath goes shallow for half a minute. No sprint, no heavy bag, just a tiny effort that used to be nothing. It passes, so you shrug it off and get on with your day. But what if that small moment is your body whispering before it has to shout? Imagine how different the next decade could look if you learned to hear these quiet signals early. Everything you'll hear now is explained in plain language and grounded in real research from trusted organizations. This is educational content to help you navigate conversations with your clinician. It does not replace medical care or emergency services. Here's the big idea for today. If you're 50 or older, certain breathing clues, especially the ones we tend to normalize, can hint at heart or lung problems long before a crisis. Global health authorities point out that cardiovascular and respiratory conditions remain leading causes of illness and death worldwide, yet many start with subtle symptoms you can catch in everyday life. According to the World Health Organization, recognizing early warning signs and acting on them can meaningfully change outcomes. So let's translate science into a practical checklist you can actually use this week. Picture your usual daily climb: 1 flight of stairs, or a short walk from the parking lot. If your breathlessness after that light effort lingers beyond about 30 seconds, and this is a new pattern for you, pay attention. The Mayo Clinic explains that persistent shortness of breath, especially if it's new, worsening, or out of proportion to the effort, may be associated with conditions ranging from heart disease to lung issues. The U.S. National Heart, Lung, and Blood Institute also notes that when your body can't deliver oxygen efficiently, even mild exertion can feel surprisingly hard. Don't overthink numbers here. What matters is your pattern. Try this. After your next single flight of stairs, glance at the clock and notice how long it takes before your breathing feels normal again. Do that for 7 days and jot down the time, what you were carrying, and how you slept the night before. The common mistake is to blame it on just age or a cold you had weeks ago. If your notes show a consistent slowdown or a clear change from your baseline, that's a useful signal to bring to your clinician. Now, think about sounds rather than speed. A new wheeze or whistling sound when you breathe, especially at night, in cold air, or after a recent cold, that sticks around for more than a few weeks deserves attention. Clinicians at Cleveland Clinic emphasize that adult-onset wheeze isn't just a children's problem. In older adults, it can signal airway inflammation, asthma that appears later in life, or even lingering irritation after infections. NIH guidance reminds us that chronic or recurring wheeze should be evaluated, because self-treating with a rotating cast of decongestants may mask an underlying issue rather than fix it. A practical move: use your phone to capture a 10-second audio note when the sound is present and write down what you were doing: lying flat, walking outside, cleaning dusty shelves. Those concrete details help a professional connect symptoms to likely causes. The mistake to avoid is assuming that if a store-bought spray or pill quiets things for a night, the problem is solved. Short-term relief is not the same as diagnosis. Nighttime clues are some of the most overlooked, especially when they become normal in a household. Loud snoring, observed pauses in breathing during sleep, choking or gasping awakenings, and persistent cough at night, followed by daytime sleepiness or morning headaches, can point towards sleep apnea. The American Heart Association has repeatedly highlighted the relationship between untreated sleep apnea and cardiovascular risks such as high blood pressure, atrial fibrillation, and stroke. Sleep apnea can show up at any body size, and risk increases with age. If your partner notices pauses, or if you wake up unrefreshed despite a full night in bed, it's worth screening. A simple self-check many clinicians recommend is the Stop Bang questionnaire. You can ask your clinician about home sleep testing if your risk looks elevated. The error many couples make is treating snoring as a harmless quirk or as just getting older. When breathing is repeatedly interrupted overnight, your heart and vessels work harder than they should. Breath changes can also appear at rest or during emotional stress. not just when you're physically active. If you feel chest tightness, air hunger, or pressure that comes on with strong emotions, or even while sitting, don't dismiss it. Harvard's clinicians have written about so-called angina equivalents, where breathlessness or chest discomfort may reflect reduced blood flow to the heart, even if it's not the classic exertional chest pain. In people, especially women after 50, microvascular angina can be part of the picture. The tiny vessels that nourish the heart muscle don't dilate properly, and the symptoms can present as breath tightness, fatigue, or pressure that's easy to mislabel as just anxiety. If this sounds familiar, write down the exact words you'd use to describe the feeling: tight band, pressure, inability to take a deep breath. Where it sits, center, left, spreading, how long it lasts, and what sets it off or relieves it. Know your red flags. If any symptom is severe, crushing, or paired with fainting, confusion, new weakness, or blue lips, call emergency services immediately. The mistake to avoid is assuming a mental health label explains everything. Mind and body interact, but the heart deserves a check when breath and chest sensations change. Sometimes the key is not the breath alone, but what travels with it. If you notice breathlessness along with ankle swelling that leaves a dent when pressed, or a sudden increase on the scale, think 2 to 3 kilograms in a week. Those together can suggest fluid buildup. Mayo Clinic and Cleveland Clinic both note that unexplained peripheral edema and rapid weight changes can be early signs of heart failure or problems with venous return. Symptoms may worsen when you lie flat, and you might find yourself propping up extra pillows at night. A practical home routine: weigh yourself every morning after you urinate and before breakfast, wearing similar clothing. Write the number down and circle any jump that's clearly out of your usual range. Also, watch for socks leaving deeper marks than usual at the end of the day. The common mistake is to chalk it up to too much salt last night, without noticing that the pattern repeats across the week. Let's turn these clues into a simple action plan you can start today. First, track, don't guess. For the next 7 days, carry a small note on your phone. What were you doing when the breath change showed up? How long until it settled? Did you hear a wheeze? Were you lying flat or on your side? Did your partner notice snoring or pauses? What did the scale show this morning? Second, change one tiny thing today to see if it moves the needle. Take stairs at an easier pace with one brief pause halfway. Go for an earlier 10-minute walk when the air is cooler. Reduce evening salty foods or raise the head of your bed by a few centimeters. Small experiments help you learn how your body responds. Third, take your notes to your clinician and ask targeted, practical questions. Could we check vitals including oxygen saturation? Is spirometry appropriate to look at airflow? Should I screen for sleep apnea? Given my family history, is there any reason to look at microvascular angina? Good medicine is a partnership. Your observations can shorten the path to answers. Let's recap the 5 breathing clues to keep on your radar. 1. Shortness of breath after light effort that takes longer than usual to settle. 2. A new wheeze or whistling sound that hangs around for weeks. 3. Loud snoring, breath pauses, or nighttime cough paired with daytime sleepiness. 4. Chest tightness or air hunger at rest or under stress. 5. Breath changes that show up alongside ankle swelling or sudden weight gain. None of these automatically mean you have heart or lung disease, but catching them as patterns, rather than isolated one-offs, can prompt timely evaluation. According to the NIH and WHO, early recognition and risk factor management often lead to better control, fewer hospital visits, and a higher quality of life. Noticing sooner can translate into more walks you actually enjoy, more stairs without worry, and more years doing the simple things you love with the people you love. You might be thinking, what if I bring this up and it's nothing? That's a fair concern. Here's a helpful perspective. When you arrive with a week of observations, times, triggers, recordings of wheeze, morning waits, you're not being alarmist, you're being informative. Clinicians appreciate concrete data because it narrows the possibilities, and if the evaluation shows everything is fine, You've still learned how your body responds to sleep, stress, and salt. That knowledge pays off. While we're here, a quick word about language. People often say, "I can't catch my breath." Try to get more precise in your notes. Was it hard to pull air in or to push air out? Did it feel like you were breathing fast but not getting relief, or like a tight band around the chest? Did your fingertips feel colder than usual? This kind of description helps differentiate airway issues, often noisy, worse with cold air or allergens, from circulation problems, often heavy, pressure-like, tied to effort, or lying flat. Harvard's clinicians and the American Heart Association both encourage plain English descriptions, quality, location, duration, and triggers, because medical jargon is less helpful than a clear story. There's another piece of the puzzle that hides in plain sight: recovery timeline. The same set of stairs can teach you a lot about your cardiopulmonary fitness. If you used to feel settled by the time you reached your front door and now you need to pause at the kitchen sink, that's a meaningful change. The NIH underscores that reduced exercise capacity is often one of the earliest markers of chronic conditions. It doesn't mean you should avoid movement, quite the opposite. Gentle, regular activity, if cleared by your clinician, often improves symptoms over weeks. The error to avoid is swinging between overexertion and total rest. Steady, modest activity plus a plan is where progress lives. Breath clues also interact with sleep. If you notice that your breathlessness or cough shows up predominantly at night, ask yourself, how late are you eating, especially salty foods? Do you drink alcohol close to bedtime? Do you wake with a dry mouth or with a sore throat from mouth breathing? The American Heart Association points to sleep as a pillar of cardiovascular health. Improving sleep timing, elevating the head of your bed slightly, or using a nasal saline rinse in the evening may reduce symptoms while you pursue proper evaluation. None of these replace diagnosis, but they can make nights more comfortable. Let's address stress, because it sits in the middle of this conversation. Emotional stress can tighten breathing patterns through the chest wall and diaphragm. That's real, and at the same time, cardiac and pulmonary causes can coexist with anxiety. A brief practical exercise when breath feels tight. Exhale slowly through pursed lips for 4 to 6 seconds, then allow a gentle inhale. 2 to 3 rounds can reduce airway collapse during exhalation and may ease the sensation of air hunger. Respiratory therapists often teach this to people with chronic lung conditions. If it helps you, great. Still keep your notes and follow up for an underlying cause if the pattern persists. If you're caring for someone 50 plus, you can be their second set of eyes and ears. Notice whether they're stacking pillows higher over time, getting winded during casual conversation, or avoiding hills they used to handle easily. Encourage a 7-day log together and offer to accompany them to the appointment. Many clinics have checklists and screening tools. Arriving with observations can make that visit more productive. Before we close, here's a human promise that science supports. Most improvement plans are built from small, sustainable steps, not heroic overnight changes. According to organizations like the NIH and Mayo Clinic, steady routines, walking most days, moderating salt, keeping a healthy sleep schedule, and taking medications as prescribed often move the needle far more than once-a-month bursts of willpower. Let your notes guide which small step you try first. If today's message resonates, tell me check in the comments so I know you'll track for 7 days. Share this with someone 50 plus who snores loudly, gets winded on one flight of stairs, or has noticed ankle swelling. They may thank you later. And subscribe if you want more practical, science-based health videos that respect your time and your intelligence. Information guides decisions. Don't stop, start, or change medications on your own. If you notice red flags, severe chest pressure, fainting, blue lips or fingertips, sudden confusion, seek emergency care immediately and bring your notes later.